One of the biggest issues we have in the prison system is mental health accessibility. And I say that because fundamentally, if you want to tell a CEO, a correctional officer, or if you wanted to speak to the doctor or whoever and tell them, hey, look, I'm not okay. I really need to speak to someone. I feel like I'm going through some form of trauma, anxiety right now. They automatically assume suicide without taking into consideration the process that goes behind actually evaluating an individual and either diagnosing him or her with any form of symptoms of depression, or maybe you do have suicidal tendencies, or maybe you just need help adjusting or speaking about what you're experiencing currently, and not understanding that some people actually look for an outlet, but the system treats it as a mental health issue to the highest extent. If I were to go to someone and say, hey, look, I'm just having a really hard time adjusting. I don't want to be here no more. What they hear is, I don't want to be here no more. This guy wants to kill himself. And that's not the case. I want to be able to talk to someone. I want to be able to express myself and my feelings without having to be looked at as crazy or get sent to a part of the prison that is for what they consider crazy people or people with mental health disabilities.
You can tell an officer that you're feeling some type of way, and they'll send you like to the clinic or something, and you can maybe speak to a mental health person in there. But the answer to everything is medication, so you're not getting to the root problem. You're not really discussing what's going on. They're just finding a way for you to suppress what's going on with you. If you know anything about medications, sometimes they do the total opposite of what they're supposed to do. And if you're taking several of them, you end up with different counteractions and stuff. You may be more suicidal than you was before you took the medication. There's nobody to talk to. You're stuck talking to yourself or a friend or someone in there that's also incarcerated, or you're on the phone. But then when you're on the phone, you don't really want to say too much because you don't want your family members on the outside to be worried. And then you only have a couple of minutes, so you just try to get everything in, and you make your family feel like everything is fine with you. But it's really not. There's nobody to talk to.
When I came in, I did not get my proper medications. My psych meds, I had to call Prisoners' Rights Project for. I came in with a torn ligament in my hand. I had to call Prisoners' Rights for that. I had to grieve it. I had to call Internal Affairs. It got so much that I called Prisoners' Rights when I really did need to see the doctor. Because you would go to sick call sometimes and not be called. You would wait there all day for hours and hours and hours and not be called. So medicines would expire, you wouldn't, things like that. So it just was non-existent. I did gain a lot of weight when I was there because there's no movement. And because before I went there, I was very active. I had walked dogs for a living, and I had my own pets, so I was very tiny when I got there. And I asked for vitamins. I was told, oh, you're fat, you don't need vitamins. I'm like, I'm fat because all I'm eating are cookies, okay? Yeah, so there were little things like that. Like, I know that there were people with health problems. Like one girl had lupus, and she didn't get her lupus medication. And when she was complaining about it, to appease her, they were like, well, we'll give you methadone. She's like, I don't want methadone. I want my medicine.
It's not the same thing.
Yeah, I'm not talking about pain management. I'm talking about the actual medication. Like, yeah. I just gave up getting actual medical care.
Most thing I have to worry about in the box, man, like, is medical attention,
they're not too serious about medical attention. And I'm an asthmatic. So, being in the box sometimes, the heat. I remember banging on sometimes, man, for hours, man, just to get my asthma medication. You know what I'm saying? It's like just to go to the clinic was a problem, was a hassle sometimes.
The medical neglect is real. They deny us medical. How in there, you know how long you have to wait just to see a doctor or nurse in there? They take you from pen to pen, like from holding cell to holding cell. It's ridiculous. For whatever services you need, whether it's mental health, a doctor, you could be with your finger hanging and you'll be waiting from, like I said, cell to cell. I had experienced me going in there with a cyst on my rear, and they wouldn't even give me no medical attention. They gave me a ice pack or heat. I don't know if it was a heating thing or ice thing. I can't remember so much. Told me to put it there. I had no access to water to be able to wash my hands. Mind you, I had already blood or whatever it was from the abscess, the cyst. So I still have like a little scar from that. It was really bad. The medical neglect is in there. They don't care.